Cefazolin classification. This medication is an antibiotic. The side effect is diarrhea, nausea, fever, vomiting, rash, phlebitis at the IV site, anaphylaxis, seizure, renal failure. Onset is 10 minutes, peak is infusions and duration is unknown. Nursing implication. I will teach patient to report any rash, fever, sore throat, diarrhea. I will tell patient to take prescribed medication for the length of time ordered for therapeutic outcome. So now I'm going to look at the policy. The first policy: before the administration of 2 or more medication concurrently via the same IV site, verify the compatibility of the 2 medication. Ensure that the compatibility information corresponds to the intended method of administration, that is mixed in infusion, syringe, or via white site. So looking at cefazolin and the fact that the patient had been on anaprelad, so I know that when I refer to the monograph, I know that both medication are compatible at the white site. So the second policy: if the combination is not listed as being either compatible or incompatible, then the medication should be treated as incompatible until additional information from additional sources is obtained. So when I refer to the monograph, I know that cefazolin and anaprelad are compatible, and they are also cefazolin is also compatible in 0.5 normal 0.5 250% or in normal saline is compatible in 0.9 normal saline. So now I want to go to the review patient's profile. So the patient's history: Mr. Garland is 5 days post-operative. He tolerated the surgery well but is experiencing complications due to infection. Mr. Garland's diabetes is unstable and wound healing is impaired. Mr. Garland is experiencing increased pain at the wound site. So the patient is complaining of pain at left leg amputation side and rates pain as 7 on the scale of 1 to 10. His dressing removed to assess the wound side. Side appears red, approximately 2 inches around the surgical side. So wound is draining, purulent drainage. Considering changing IM antibiotic to IV. So for the vital signs, the temperature is 38.5, his heart rate is 110, his respiratory rate is 18, his blood pressure is 120/17, his oxygen saturation is 98% on the right arm. So for the lab values, his white blood cell is 25.7, it is high, and the absolute neutrophil is 9.1, it's high, and the absolute monocyte is 1.13, it's high. The absolute basophil is 0.24, it's also high. So for his sensitivity culture, so when I look at that, it will indicate reasons why Mr. Garland's seed is having an infection. So I'm going to sign my signature sheet, the date, my full names, my status is SPN2, my signature, and then my initials. So now I want to compare the doctor's order to the map. So I'm taking my doctor's order and I'm comparing to the map. Patient is Garland seed. MRN number is 344316, 344316. Date of birth is 11/08/1965, 11/08/1965, and allergy is penicillin and codeine. Allergy, penicillin and codeine. So the drug is cefazolin. The dose is 500 milligram. The route is IV. Frequency every 8 hours. And the time is 6 a.m. The site is the left arm. and the reason why patient is taking this medication is for infection. So for special instructions, patient should be on this medication as for the length of time prescribed, which is 7 days, for a positive therapeutic outcome. And I am done comparing the doctor's order to the MAC. So right now, for the volume of solution prescribed by the doctor is 250 mils, 0.9% normal saline. That has been ordered by the doctor, and it was ordered to run at the rate of 125 mils per hour. So I am going to refer to the monograph for the solution to be diluted in. So it says dilute in 50 for the solution that the medication can be diluted in. It says dilute in 50 to 100 mils of IV solution. So so cefazolin is being diluted in 50 mils normal 0.9% normal saline, which I'll be giving to the patient. And it says infuse over 10 to 60 minutes. So I have choose to infuse over 15 minutes. And the reason why I am infusing for 15 minutes, 15 minutes is rapid, and the reason why I am infusing for 15 minutes is because patient has infection at one side, and the infection is draining purulent drainage, and so it requires an emergency. It's an emergency situation, so it requires an emergency intervention. And after that, I want to look at the compatibility at the white side. So for white side med-to-med, I know that cefazolin, looking at the monograph, I know that cefazolin is compatible with anaprilat, which the patient had been on, and at the white side, cefazolin and anaprilat are compatible and they are stable, so I don't need to flush the tubing or change the tubing. And for the medication with the diluent is 50 mils, 0.9% normal saline, and the medication is cefazolin that will be added to it. So when I look at the monograph, I know that cefazolin is compatible in 0.9% normal saline, so it will be compatible with the diluent. And looking at the mainline infusion and the medication, which is cefazolin, and the mainline infusion, which is 250 mils, 0.9% normal saline, they are both compatible and they are stable. So I want to go to the patient's room, and then I'll be assessing the mainline infusion. I'm going to patient's room to infuse, to assess the mainline infusion. So this is 200, and I'm going to do hand hygiene, and then I am assessing the mainline infusion. This is 250 ml, 0.9% normal saline, and the expiry date is December 2020. There are no leakages on the back. And moving down on the drip chamber, I see that it is dropping at 125 ml per hour as ordered by the doctor. Looking at the tubing, I see that the tubing is labeled with the date and time of infusion and the nurse's initials. I am looking into the tubing. There are no bubbles and there are no leakages in the tubing. So going towards the side of the site, which is the left arm, I know that I can see that, look at the scale of infiltration and phlebitis, the score is 0, and there is no leakage on the side, there is no edema, there is no rash, there is no redness, and the side is dry and intact. There is no leakage on the side, so the side is okay for for to run the IV. So I am returning, and I want to verbalize pre-assessment. I have pre-assessed the patient, and I know that at the scale of infiltration and phlebitis at the side, the score is 0. I have checked the patient's vital sign, and I have checked their pain score, and on the side I did not see any discharge. I did not see any drainage. I did not see any swelling, any inflammation or edema around the area. And then I also asked the patient if they are feeling any nausea, any vomiting, or if they are having any diarrhea. So now I'm going to do my hand hygiene. I'm doing my hand hygiene, and then I'll take my pre-mixed medication in the mini bag. So I want to assess for clarity of the fluid, so of the solution. So there is no cloudiness in the solution. There are no leakages in the bag. It is nice and intact. And it says the expiry date on the bag is January 2021. And on the label, I see the patient name is Galenseed, and the medication is cefazolin 500 milligram in 50 ml normal saline. And it's an IV solution. The route is IV, and the frequency is every 8 hours, and the expiry date is August 2028. So now I want to do my first check. I am comparing the medication label to the MA. So patient's name is Galenseed. The drug is cefazolin. The route is IV. I have IV. The frequency is every 8 hours. And the dose is 500 milligram. The dose is 500 milligram, and it comes in 50 ml normal saline. And the time is 6 a.m. and the site is the left arm. And the reason why the patient is on this medication is because they're having an infection. So that is my first check. I want to do my second check. So the patient is Galenseed. I have Galenseed, and then the drug is cefazolin. The dose is 500 milligram. The dose here is 500 milligram in 50 ml in normal saline, and the frequency is every 8 hours. The route is IV. The side is the left arm. The time is 6 a.m. and the reason why patient is on this medication is for infection. So I want to do my first calculation. So I am calculating gravity and pump. So for gravity, the formula is volume per ml over time per minute times drops per ml, which is equals to the volume on the back. It says 50. The volume of diluent is 50 ml divided by the time, which is 15 minutes, times 10 drops per ml. So ml cancels ml, and I'm doing 50 divided by 15 times 10. So I'll be infusing at 33 drops per minute. So for the pump, the formula is volume per ml divided by time per minute times 60 minutes, which is equal to 50 ml divided by 15 minutes times 60 minutes, which is equals to, so minute cancels minute. So I'm doing 50 divided by 15 times 60. So it will be infusing at 200 mils per hour. So that is my first check. I don't know if they can see from here. First check. That is my first calculation, rather. First calculation. Is that okay? Okay, that's my first calculation. So now I want to do my third check. So I am checking the medication level to the map. So I have patient is Galenseed. The drug is cefazolin. I have cefazolin. The dose is 500 milligram. Dose is 500 milligram in 50 mils of normal saline. The route is IV. The frequency is every 8 hours. And the side is the left arm, and the time is 6 a.m. and the reason why patient is on this medication is for infection. So I am doing my second calculation. I'm calculating gravity. The formula is volume per mil divided by time times per minute times drops per mil. So I have 50 mil divided by 15 minutes times 10 drops per mil. So mil cancels mil. I have 50 divided by 15 times 10. So I'll be infusing at 33 drops per minute. And for the pump, the formula is volume per mil divided by time per minute times 60 minutes, which is equal to 50 mils divided by 15 minutes times 60 minutes. So minutes cancels minutes, and then I'm doing 50 divided by 15 times 60. So I'll be infusing at 200 mils per hour. So this is my second check. That's my second calculation. Okay, so now I'm going to call the invigilator or my tester to come and do an independent double check. To confirm that my calculation is right. When that is done, so I am going to do my hand hygiene. So I'm going to get my secondary set. I want to connect my secondary set to my premix